How often do you take antidepressants? Is it possible that antidepressants are overprescribed as society battles rising levels of anxiety, depression, and other mental health challenges? Antidepressants have become a familiar first-line treatment. While these medications can be lifesavers for many, critics argue that they are overprescribed, while proponents stress their importance in managing mental health conditions. What are their long-term side effects? Can you become entirely dependent on them? Critics of antidepressants say that the feeling you get from using them simply hides the symptoms with medication without addressing the root causes of mental distress. Some argue that overprescription stems from a medical model overly focused on chemical solutions. This perspective suggests that busy primary care doctors may find it easier to write a prescription than engage in extended therapy sessions, especially within the constraints of limited appointment times. Direct-to-consumer advertising by pharmaceutical companies can create a misleading impression that there's a simple pill for every complex emotional struggle. On an individual level, the stigma surrounding mental illness might push people towards seeking a prescription-based solution, believing therapy could be seen as a sign of weakness. However, proponents of antidepressants point to their effectiveness in treating debilitating conditions like severe depression, generalized anxiety disorder, and panic disorder. For many, these medications offer a lifeline, enabling them to function, return to work, and engage with the world. They argue that the rise in prescriptions could simply reflect increased recognition of mental health conditions that were previously undiagnosed and untreated. Proponents of antidepressants caution that dismissing their benefits could lead to unnecessary suffering and even tragic consequences. Some critics argue that we've become too quick to seek a pharmaceutical solution for the normal stresses of life, rather than building healthy coping mechanisms that help tackle poor mental health. Loneliness, social isolation, financial pressures, and the demands of modern life all play a significant role in our collective well-being. Relying on medication alone may cause certain individuals to neglect their problems until they accumulate to the point where solving them becomes complicated. But can antidepressants solve all mental health problems? Depression itself is influenced by a combination of genetic, biological, environmental, and psychological factors, and there is no one-size-fits-all solution to treating it. The decision to prescribe antidepressants should be made on a case-by-case basis, taking into account the severity of the condition, the patient's medical history, and their response to other forms of treatment. Ideally, antidepressants should be part of a comprehensive treatment plan, not a standalone solution. Combining medication with therapy, which teaches coping skills and addresses underlying thought patterns, generally proves to be more effective. Lifestyle changes such as regular exercise, mindfulness practices, and a balanced diet also play a crucial role in managing mental health. Open conversations between patients and healthcare providers are vital to discuss treatment options, explore potential long-term side effects, and formulate a strategy that prioritizes overall well-being.